Hi, and welcome back to Focal Point, AFR Talk. Got to take care of one item of business. Let me send this over to my producer, Jeff Reed. We'll get that little item of business out of the way, and then we can get back to content. Now, we've talked about the threat that President Obama represents to religious liberty. I mean, this whole Hobby Lobby thing, Obamacare, is the greatest threat to religious liberty currently that exists right now. Right behind that is the homosexual agenda and its threat to religious liberty. New York Times reporter saying, look, not only is President Obama a threat to religious liberty, he's a threat to freedom of the press. This is the New York Times. And what the New York Times reporter is saying is that the Obama administration is the, quote, greatest enemy of press freedom, end quote, in a generation. This is New York Times reporter James Risen, greatest enemy of press freedom that we have encountered in at least a generation, explaining that the White House seeks to control the flow of information and those who refuse to play along will be punished. Risen made the remarks while speaking at Sources and Secrets Conference, a meeting of journalism, communication, and government professionals, which was held in New York City. And he said, look, press freedom is under serious attack in today's America, and the media has been too timid in pushing back against the onslaught. I want to give you an example, and Rob, I'm going to shift gears. I want to drop down to, what is that clip I want to grab? Maybe I didn't get that on here. I know it's a story that I want to talk about, talking about the media and their timidity. This is from the Media Research Center. You and I know what a catastrophe Obamacare is. In fact, that does tell me the clip I want to grab. Rob, let's grab clip number 7, the one from the television station in Ohio. I'm going to just have Rob play for you just an excerpt from a newscast from a television station in Ohio. This Obamacare deadline is coming up March 31st. And if you don't buy your insurance by March 31st, you will not be able to buy insurance until November. You won't be able to get insurance till November. You'll be out of luck. Even if you want it, you will not be able to get it through one of the exchanges. You won't have an opportunity to claim any of the subsidies and all that, that kind of stuff. But most people have no idea of the absolute catastrophe that Obamacare has been. And do you know why? I did not realize how ignorant the American people are on Obamacare. Now, you are informed. You know what's going on with Obamacare because you listen to Focal Point. You listen to AFR Talk. So you are informed. You are not a low information voter. And the reason that people are low information voters, or when it comes to Obamacare, they are no information voters, is because the mainstream media is not telling people anything about Obamacare. In other words, if you listen to the mainstream media, you would think that Obamacare is going along swimmingly. You wouldn't have heard about the increase in premiums. You wouldn't have heard about the increase in copays. You wouldn't have heard about the increase in deductibles. You wouldn't have heard about the reduction in hours. You wouldn't have heard about the cancellation of insurance policies. You wouldn't have heard about people being frozen out. You wouldn't have heard about people thinking they had insurance and not having it. You wouldn't have heard about people getting stuck with $407,000 in medical bills because of Obamacare, because of glitches with the website. Well, here's the reason. Even though Obamacare is the central political issue of 2014, this according to the Media Research Center, so far this year, the 3 network evening newscasts have minimized, spun, or ignored every negative development about Obamacare, while at the same time touting staged pro-Obamacare publicity stunts, such as the president's appearance on a web-based comedy show in March. MRC analysts reviewed each newscast, including weekends, from January 1 through March 24. Every newscast for the last, almost 3 months. The review found just 29 stories from January 1 to, and remember when the whole thing rolled out, to March 24. The mainstream media, that's ABC, CBS, and NBC, did a total of 29 stories in their newscasts that even mentioned Obamacare. Only 12 of those were full reports. The other 17 were short items of less than 30 seconds in length. Now, NBC Nightly News, in all this time, January 1 to March 24, aired one full report on Obamacare, which was a celebratory piece on January 1 about the wonders of Obamacare and the wonders of the Obamacare rollout. Now, since then, or including that piece, including that January 1 piece, Nightly News has offered 5 minutes and 5 seconds of coverage of healthcare law so far this year. So if you're watching NBC Nightly News, you were counting on them to keep you informed about what's going on in America. You would have heard 5 minutes and 5 seconds of coverage about Obamacare. Now, you stack that up against the total time of all the news stories on NBC Nightly News during the same period. That's more than 24 hours. So NBC from January 1 to March 24 has had 24 hours of news broadcasts. Now, what this means is that NBC has spent 1/3 of 1% of its available evening news airtime talking about the healthcare law, 1/3 of 1%. No wonder the American people have no idea what's going on. Now, you go to ABC, they devoted 6 minutes and 58 seconds to Obamacare. CBS Evening News, 19 minutes, 21 seconds. You add it all up together, that's 31 minutes and 20 seconds, approximately 0.72% of the total news time on the 3 evening broadcasts devoted to Obamacare, less than 1%, 0.072%. Not one of the evening newscasts bothered to cover polls, even their own, showing the law's continued unpopularity. So even when they did their own poll and showed how dismally people view Obamacare, they didn't even cover their own polls that they commissioned and paid good money for. Only one report on CBS, it was on CBS, profiled somebody who has been victimized by Obamacare's new rules, something that ABC and NBC viewers have yet to hear about. So if you were watching ABC and NBC, you would not have heard one single solitary story about somebody who was victimized by Obamacare. And if you watch CBS, you would have heard one story total. Rob, let's play clip number 7. This is an excerpt from a news station in Ohio. Remember, the Obamacare deadline coming up the end of this month, in less than a week. Let's listen.
Time and Obamacare wait for no man.
You know when the deadline is, right?
No.
A week from today.
Really?
Or woman.
Do you know when the deadline is for Obamacare?
No, sir.
1 week from today.
Wow.
The deadline for the uninsured to sign up is the end of March. But not only are some Ohioans unaware the health care clock is ticking, a few are saying, hold on a minute, I don't want it.
Well, to be quite honest, I haven't been to a doctor in years. I don't need a doctor. I don't need any sort of health insurance.
For others, the problem is financial. Despite subsidies are available.
It would be a hard chunk out of a family of 4 to afford that insurance.
If you don't enroll by next Monday, you'll be out of luck until November.
All right, they don't know, they don't care, they can't afford it. Now, back up to clip 6, Valerie Jarrett. And ladies and gentlemen, what you're about to hear is an absolute bald-faced lie. I'll prove it to you, then we'll hopefully have time for a phone call. Valerie Jarrett, chief advisor to President Obama, telling a lie.
What we've seen over the last 4 years since our health care plan was passed is we've had less increase in premiums than ever before in the last 50 years. And so we're beginning to, as we say, reduce those costs. And that's a big part of the Affordable Care Act, is that we want to emphasize outcomes, not just how many tests the physician ordered, but how can we actually have patients, Americans, be healthier.
Now, here's the truth. She says that premiums, let's see, we've had less increase in premiums than ever before in the last 50 years. Here's a story, dailycaller.com. Premiums have risen faster in 1 year under Obama than in the prior 8 years total. 1 year of Obamacare, premiums for individual plans rose 39%. That's since February of 2013. Between 2005 and 2013, average premiums increased 37% more in 1 year than in the previous 8 years combined. I got a couple of other stories, but we'll leave those for tomorrow. Let's grab a call. Let's go quickly to Pat in Moline, Illinois. Pat, welcome. What's on your mind? Pat, are you there?
Yes.
Yes, go right ahead. What's on your mind?
Oh, yes, thank you. I'm calling about World Vision
Yes, ma'am.
situation, and I would like to pull out. I'm not happy at all about this. My son and I sponsor a child in Lebanon, and we also have a child through Compassion. My concern, I guess, is for the child himself. We send letters, and I think, to just pull out and say, we don't care about you anymore. So it's kind of maybe an emotional sort of thing.
Yeah, it sure is.
And so I'm kind of thinking, well, maybe I'll just wait a short time and see if they change their mind. I will voice my concern to them and make that very clear. I will say that World Vision generally asks for more expensive gifts, like $80 to $100 for birthday or other celebrations, whereas birthday, Christmas, whereas Compassion is much more conservative in what they ask for.
Yeah, that's one of the things I liked about Compassion International. Well, I understand what you're saying, Pat. You don't want to leave the kid high and dry, and that's where you might let World Vision know, look, I'm going to be phasing out my coverage. I would love to see this child cared for, and I want to give you time to find somebody else to sponsor this child. So you give World Vision, and this is what they specialize at, is finding children that have needs and getting resources to them. So you give them, 60 to 90 days to get someone else to sponsor that child and let them know why you're shifting to another organization. All right, Pat, appreciate your concern. Obviously, Pat's concerned for the child. That's why we're doing this at all. Well, that's it for today. Do not forget, ladies and gentlemen, we are fighting a winnable war. See you tomorrow.